in looking specifically at the overview, enrollment, and onboarding for healthcare and provider organizations. So my name is Sean Kennedy. I am the Director of Health Information Exchange here at the Massachusetts eHealth Institute, part of the Mass Technology Collaborative. And our special guest for today is Amy Caron. She's a project manager for MeHI Communications, Outreach, Education, and represents the Executive Office of Health and Human Services. She joined the HIway about 6 months ago, actually coming to us from New York City Rec, where she led the Rec program down there, and brings just wonderful experience and a lot of passion to the program. So she's certainly a boon for the Commonwealth. So, so with that, certainly welcome Amy. And let me just go over a couple of logistics, if I may, for the presentation. We've got everyone's lines muted at this point, and we'll ask for you to hold your questions till the end. What you're free to do, however, is in the questions area, if going through the presentation you have a question, feel free to enter it in the questions area, and then we'll go ahead and review those at the end and answer those at the end. You'll also have the opportunity to raise your hand, virtually raise your hand, and you can go ahead and we will unmute your line and allow you to ask a particular question. After the presentation, we'll send out an email that'll have a link to the slides. And we'll also have a short survey. And we'd really appreciate everyone taking the 30 seconds to just quickly fill out that survey so we can get your feedback and help to improve some of our events. We also have a number of polls that we'll be launching over the course of the webinar to make this a little bit more interactive, but also so we can get some feedback real time from you, and then ultimately do a quick adjustment, perhaps even on what we're talking about. In our first poll, we are going to launch now, which is, what topic are you most interested in today? So we'll go ahead and launch this. One moment. Oh, great, that's good. So you go ahead and answering that, and while you're contemplating your answer, I'm going to go ahead and offer a brief overview of MeHI. So the Mass eHealth Institute is a quasi-government agency. We're actually a division of the Massachusetts Technology Collaborative, which is a public economic development agency. We've got two sister organizations, the Massachusetts Broadband Institute. They do a lot of work of rolling roughly 1,200 miles of fiber out across western Massachusetts and north central Massachusetts to bring broadband to that part of the Commonwealth. And they also have a program called Mass Vets Advisor, which is a benefit finder for veterans. Our Innovation Institute does things such as the Tech Hub Collaborative, bringing industry, academia, and government leaders together to figure out interesting ways to spur innovation in the state. There's a Big Data Initiative, Advanced Manufacturing Collaborative, and we also publish the Innovation Index, which is a set of measures, index measures that we publish on an annual basis. So MeHI is the designated agency for designated state agency for health IT. We do a lot of work around coordinating, accelerating, and promoting broadly health information technology for the state, really working ultimately to advance the dissemination of electronic health record systems in all healthcare provider settings. So let me go ahead and pause. We'll go ahead and close our poll now, and we will show the results. And it looks like we have got, let's see, 67% of you are interested in connection type options, and 65% interested in onboarding process, with 22% around use case development and 33% around preparing paperwork. So clearly the use case and paperwork side of things are a little less interesting, which makes sense. So anyway, we'll focus the presentation accordingly, and again, we'll answer questions as we move toward the end of the presentation. And with that, let me go ahead and allow Amy to kick off the presentation.
Thanks, Sean, and thanks everybody for joining us. So again, this presentation, we want to outline the steps to connect to the Mass HIway. So we're going to briefly, or we'll try to adjust, but we're going to try to touch on all of these topics. And again, we've got that survey at the end that I really hope you guys all figure out because next steps from here for us are to take the feedback that we get from all of you and develop more targeted educational sessions in the future. So this section just provides an overview of the MeHIway and the benefits and services. So I just want to describe a bit about who we are. Again, the MeHIway is managed by the Massachusetts Executive Office of Health and Human Services, or EOHHS, and that includes the design, operations, client services, general maintenance, and all that. We're governed by a diverse cross-organizational HIT council and informed by consumer, provider, legal and policy, and technology advisory groups. This is to promote a multi-stakeholder, transparent engagement model. Meeting notes and all of the presentations from those meetings are available to all at mass.gov. Now, the Mass eHealth Institute, or MeHI at Mass Tech, also ran our MeHIway Last Mile program that ended back in February. The goal was to help providers connect and adopt the MeHIway into practice. Now, the Mass eHealth Collaborative, or MeHIC, served as the subject matter experts for that program. So both organizations support efforts to increase health IT and MeHIway adoption. So whether you're talking to someone from MeHI or MeHIC or the MeHIway, it's okay. We're all working on this together. So our goal was to deploy a secure statewide health information exchange that's accessible to the healthcare community, regardless of affiliation, location, or differences in technology. It can be used for the purposes of PPO as allowed under HIPAA, and current eligible participants are Mass licensed providers, health plans, legal entities, and business associates. The big goal of an HIE is really to serve as a tool that providers can use to improve quality and patient satisfaction while reducing costs. Now, the vision is that by efficiently using a health information exchange, clinicians will have relevant, up-to-date information on a patient more readily available and in a usable format so they can make quick and informed decisions. So we know doctors become doctors because they want to provide the best patient care. But what surprised me most, certainly when I first got into healthcare, was the administrative burdens that medical practices are under. So whether it be in private practice or a large organization, there are many, many things that can get in the way of just being able to provide patient care. The biggest things that have come up when introducing another tool into a medical practice, like certainly an EHR or an HIE, is will it save time, will it help save or earn money so we can get back to providing patient care? And the thought behind an HIE is that yes, in addition to being a tool to improve care, over time, integration of an HIE can also help increase efficiencies and productivity, reduce costs, and help earn more revenue. So determining that value proposition is important and will depend on your practice needs and what the services are that we offer, and that's where the use cases will come in. So two-phase approach to development of HIE. We have direct messaging services. That's the secure push of health information in an encrypted message from point A to point B. Those are available now. And we have query and retrieve functionality that allows query, location, and retrieval or pull of health information. These services were launched early in the year, and we're preparing for a wider rollout later on. The best way for an organization to really prepare for these services is to integrate direct messaging into practice. There's much more detailed information about these services available on our website here at masshiway.net. It's important to remember MeHIway is not a clinical data repository, not a hub-and-spoke model HIE. Instead, we provide the secure network and the tools that providers can use to locate other providers and securely request, send, and receive information. We don't store the clinical data about your patients, and nor can we read any of those messages that are sent over our network. So a HISP, or a Health Information Services Provider, is that organization that manages security and transport of health information using the direct standards. It's a network that connects your EHR to other EHRs. So you need to be in that network to be able to send the messages. So the question came up as to whether or not the MeHIway is a HISP, and we provide these services. So yes, we do serve as a HISP. You need to trust that network. We established a trust fabric that helps to ensure that privacy and security and offers delivery assurance so you can feel confident that that data is protected and it gets to where you need it to go. And one of the biggest ways we intend to serve the community is being that network of networks. So we're working to connect with other HIway as well as regional HIEs. Those networks have a ton of value locally, but the vision for the MeHI is to help providers within those networks connect to others outside of those networks across the state and eventually beyond. When you think about patient care, patients don't often see providers in the same area or within the same network, so the MeHI seeks to connect all of those. We are testing with several HIway, and we actually just first secured our first HIway to HIway contract, which is exciting because there certainly are many of them operating across the state of Massachusetts, and that's something you need to check with your vendor directly as to whether or not you can connect to their HIway or ours. So a big driver for connecting the HIway now is meaningful use. We've got public health measures and the transition of care measure, which are the two big ones where the MeHI comes in. And I want to take some time on this one. I don't want to go into the weeds of meaningful use because it's hard to get out once you do. But the DPH and the MeHI have partnered to transition all data reporting over to the MeHI. The key goals of this are to automate the data import process, simplify the administrative process, and remove as manual interventions as possible on that data. So this, over time, can reduce costs for you because you'll eventually be maintaining fewer reporting interfaces. So while there's no specific requirement in meaningful use that you need to use an HIE for your DPH reporting measures, here in Massachusetts, the only way that you'll be able to transmit data to the DPH is going to the HIway. So for eligible hospitals, you'll need to be submitting your syndromic data over the MeHI. So regardless of what's happening with the connection, we'll need to have you enroll with us first and register your intent with the DPH to begin the process. For the measure, you don't have to achieve an ongoing submission, but you at least need to be able to show that you're working with us and the DPH. So if for some reason progress gets stalled, we have documentation that's available to back you up for your attestation. Now this come up a lot too, but this applies to eligible hospitals only. Eligible providers just need to print the link here that you see. There'll be verbiage on the page that will explain that here in Mass, this is only for eligible hospitals, and you use that for the exclusion. Immunizations is a core requirement for both EPs and eligible hospitals. So if you're currently on the HL7 clinical gateway and your vendor isn't ready to support data transmission to MIIS over the HIway in time for your reporting period, you can continue to submit over the HL7 clinical gateway. I will stress, once your vendor is ready, we'll need to move that connection over to the HIway, so you should really take that first step and enroll with us now. New providers are not being brought on to that gateway, so you should definitely enroll with the MeHI now so you'll be ready to submit to the MIIS. And for an EP, stage 2, there are actually a couple of registry measures, menu measures that have been added, and we have the Mass Cancer Registry and the Opioid Treatment Program over the MeHI for your new menu measures. We're also working on a webmail connection to the DPH, and if necessary, we'll install a LAN box and charge you only for that device, for that DPH connection, to make sure you're ready to meet these measures. Now, for all of this, you'll still need to work with your vendor on the correct message templates, and more information on that can also be found there on that website. So while our primary aim is to ease public health reporting, we don't want this to be a barrier to meaningful use achievement. So documentation for exclusions may be granted on a case-by-case basis, but again, it's only if you're actively working with us and the DPH. So for transition of care, you'll need to transmit a summary record electronically. This is one you don't necessarily need to use the MeHI to do it, but we have a growing network of providers across the state, and we are providing a cost-effective solution to HIE. Another key driver is development of these pay-for-quality programs and risk-sharing models as supported by the ACA. Here in Massachusetts, for example, we have the new Primary Care Payment Reform Initiative. The providers in that program will use the MeHI as a tool to integrate behavioral health services into primary care, and we'll include some quality-based metrics there. And hospitals and provider groups will be exploring becoming accountable care organizations, and there's certainly been enough experience to know that HIE is a critical tool to the development of an ACO. And the MeHI serves as a cost-effective solution to an HIE because the infrastructure and the services are there to use. So with the ACA, that first step was to get people covered, and the next step is improve quality and patient satisfaction while reducing costs by addressing key areas of how healthcare is delivered. So we have case management. It's that collaborative process that aims to get the patient all of the services they need to become and stay healthy. This is really important in treating some of the most complex and oftentimes the most costly patients. MeHI certainly supports this secure information sharing between all of the key providers and along with the payers who often manage some of these programs. Another key area is care coordination. And we hear about this one a lot because this is where we talk about these hospital readmissions and the duplicative testing, which are seen as some of the most costly and avoidable burdens on the healthcare system and the patient. So the MeHI is, again, that tool you can use to make sure that medical history and all the important information goes between the care teams. And quality reporting, again, is another area that the MeHI supports and offers that foundation for those quality improvement programs. So how are our participants doing on all of these use cases? Well, slowly but surely, we're seeing a steady increase in usage among each of these areas, as shown here from our November to mid-February transaction data. So we currently have over 200 organizations signed up and 100 organizations live, with many sites included under that. So in short, really, the MeHI is really starting to show some value in the community. And the more providers and organizations that get connected, the more valuable the tools will become. We do have our participant list also up on our website at masshiway.net. So connecting to an HIE and integrating it into practice is hard. It takes time. But there's more recent data that the hard work can really pay off. Significant costs were saved, and there were improvements on key quality indicators in these instances just by using the HIE and related tools in a small percentage of encounters. So the key takeaway is you consider the MeHI a tool that can help you do these things. And like with any tool, like your EHR, your organization as a whole is going to need time to plan for and adapt to it. And determining the right initial use case can help your organization really plan the effort and determine the value proposition specific to your organization. It can also help you understand the workflow considerations before you go through this massive organizational change. The goal is to really set the organization up for success. And since MeHI has led the efforts on the use case development, I will hand it back over to Sean Kennedy.
Thanks a lot, Amy. This is great. So let's now turn our attention to some work around determining your use case. So before enrolling with the HIway, as Amy had mentioned, it's good to think about the use case that you're looking to bring to life, if you will. So a use case, if you're not familiar with them, is really an easy-to-understand description detailing the interaction of an actor. Right? This could be a human, an organization, or a system, and the system under consideration. So for HIway purposes, it really identifies a set of trading partners and source and destination systems and describes how they intend to use the MeHI. When you think about some of the benefits of use cases, they're really developed with the goal in mind, which makes them a really helpful planning tool. It also helps you identify the clinical and business needs before solution development. You know, we all hate rework and delays, and this helps mitigate those concerns. It also facilitates initial scoping, project planning, and effort prioritization. When you start developing kind of your scenario or your story, you start to realize all the work that's actually involved in this, and you start to understand what are those long lead items that you need to start working now, like working with your vendor. That's not something you may solve the problem by tomorrow. It may take you a couple months to get where you need them to be. It also supports selling your request to management. Having your senior leadership team on board with this is really important because this really is an organizational change effort. And it really shows you've done your due diligence to articulate the value, not just the functionality you're looking for. And it also helps you support the identifying the project team and the stakeholders. So we've got a number of grantees that are doing a lot of pioneering work on the HIway. We awarded 32 grants, and these are a sampling of the use cases that they are using in working to build into the HIway. And a number of them really bubble to the top. So the idea is that you could be sending information, you could be receiving information, or you could be doing both. But in either case, a care summary referral requests, and hospital discharge summaries were really the top use cases that we saw. And certainly a number of other ones around medication reconciliation, image notifications, exchanging of labs, submission of public health registries. All are some other examples of different kinds of use cases that people are working on. And we hope to write up some case studies that will be available for you. And we're also working on building out a use case library that you may be able to reference at a later point in time. But all of it is really gearing toward building stories, right? So it really takes a fair amount of work to bring a use case to life, and ultimately that's working toward achieving some particular outcome. This is a sampling of some of the work that we're working on out in Western Mass with the folks at Berkshire Health and Bay State. They're working on reducing duplicate tests for high acuity cardiovascular patients. Down in the Springfield area, they've got a number of organizations working on readmissions, reducing readmissions, and improving care management for heart failure patients. Out in Worcester with UMass Memorial Medical Center and CVS Minute Clinic, they're working on sharing information between the two for shared patients. The folks down in Milford Regional Medical Center are working with their skilled nursing facility and home health care to improve transitions of care by sending discharge summaries. And then here in the Boston area, we've got the Boston Healthcare for the Homeless program is working with Ease Care, an ambulance service, to improve pre-hospital transport and care coordination for the homeless. And then we have a couple health plans involved in this as well. And one of them, Network Health, is working with Brockton Neighborhood Health Center to coordinate care plans for the benefit of their shared patients. Now, we've developed a template that we think people may consider as they're developing these use cases. And there's a number of questions you may ask yourself. So the first one is, why are you connecting to the HIway? You know, articulate a goal. Is it for meaningful use, transitions of care? Is it for other reasons, strategic, that you may have? What is the scenario that you're putting into place? So tell the story. You know, tell the story of, I'm a PCP. I need to send a referral request over the HIway to my trading partner, the specialist, and that helps you with doing a fair amount of scoping of what it is you need to do. Who is your trading partner? I can't tell you how many times I've talked to folks who joined the HIway, but they haven't really identified who they want to share information with. It's really important to know who you want to share with. What systems or data sources are involved? What is the data being exchanged? Are you sending, receiving, or both? So if you're sending, can you create the data set? If you're receiving, can you actually digest that data set? And these are a lot of questions. There's a lot of information behind these, but starting to address these questions early on, and then perhaps using this template as a way to work through those questions may be a way to make sure you move rapidly through this process. And just a couple of final thoughts. Amy mentioned that there's a website out there, masshiway.net. You can see a listing of the current HIway participants. I encourage you all to engage your clinical and business leaders early. This is not just an IT project. It may be the connecting part, may be very IT-centric, but the use case is certainly clinical and operational in nature. So engage them, get them working with you early. And the Mass HIway this is new. And this is new to a lot of organizations, so plan the time to get this fully integrated into your practice. And I'd say look to what you're doing now. If you're faxing a referral from a PCP to a specialist, consider that fax as your initial data set and figure out how to get that in or out of your EHR. And there's a lot of privacy and security regulations that are out there, and you want to make sure you're well protected. The Mass HIway offers you more security to do what you do every day. And then finally, determining your use case helps inform choosing your connection type. And from there, Amy's going to go ahead and continue on with the presentation.
Thanks. So this section will get into choosing a connection type, which I had actually hoped that I could rush through, but I will try my best to provide a bit more information, given that I can understand this is an area that folks need a little bit more info on. So there are several things you need to consider when you're selecting a connection option, and each really reflects a level of readiness of the organization and the resources that are available. I'm going to note here that we do have on our participation agreement, there's a line item where you're asked to select a method. And I want to stress now that You're going to pick the choice that you think is right for your organization, but you're not stuck to it, because once you get into onboarding, you'll be working directly with a service manager that will confirm that connection to make sure that you make the right one for you. So it can change. So we'll start with webmail. This provides for communication on the HIway through a web browser, like you're familiar with, as Internet Explorer or Firefox. You log into a website and you send and receive messages manually. It looks pretty much like Gmail, Yahoo, other online email sites, and has pretty much the same capabilities. Attachment files can be sent through webmail, and all of the communications are completely secure. So the webmail solution really has the lowest investment and impact on your organization. You can sign up for a webmail account as long as you have an internet connection and access to a computer that runs either Microsoft Internet Explorer, I believe it's version 8 or higher, Firefox 10 or higher, or Safari 5. So when you're on webmail, you communicate on the HIway using S-MIME, and that's secure email. The payload is sent as an attachment, and all of the uploaded attachments are scanned by an antivirus package. All webmail traffic is routed through the HIway, which will transform webmail attachments into S-MIME or XDR as required by the receiver. So it's minimally invasive on somebody's practice, and it's for really small volume transactions over the HIway. But at the end of the day, it's really a good way to just get started with, moving off of a fax machine, and maybe the use case is sending information to one specific provider. Which, again, is a great way to get started. It's a great way to get folks at your organization used to moving away from the fax machine. So the LAN is a pre-configured gateway it's locked onto your network and allows for high-volume connection to the Mass HIway. So it's a physical piece of hardware that's installed at your site. It's used to create and encrypt messages, and then uses the internet to securely send the information over to other Mass HIway participants. I think this is really best for maybe health organizations or larger groups that are awaiting the direct connection capabilities from their vendor, or may not be using an EHR application. So I think with that, I'm going to move on to the direct solution, which this is the most robust connection and allows you to send and receive messages, data, and information, just EHR to EHR, using a secure protocol based on the direct standards. This connection provides the largest opportunity for an organization to fully integrate the HIway connection. But it does require some pretty hefty infrastructure and the IT staff to really manage it. And this actually really depends on your vendor capabilities as well. So the Mass HIway is working actively with all of the top EHR vendors in the state to establish their connectivity first of the direct solution. And then the plan will be that they will roll it out to sort of a select few sites first and prepare for wider rollout to their clients. So really you need to check with your vendor first on the status of their direct connection with us, and if they aren't planning on a direct connection with us, ask them to and send them our way, and we will work with them. So a bit about the rates. Because we're funded 90% from CMS with state matches, we're able to keep our rates super competitive and tier them based on organization size and type. The rates include a one-time setup fee and an annual service fee that depends on the connection type that you and your service manager ultimately choose. So these private sector contributions, like these fees that we're getting, that's going to help sustain the program in the future as the funding fades out. So this rate card is available on the website, and these rates for direct messaging are still valid. So a couple of quick sample calculations for Mass HIway for a hospital and a small practice. And I'm going to say here, too, that depending on the circumstances, say if you come in through a HIP when your HIP connects to the HIway, you pay the charges to your HIway, and you're not going to pay additional charges to us. And again, like I mentioned before, say if your use case is specifically to get connected to the DPH, and say as an interim solution we need to install a LAM box at your site, we'll do so and charge you only for the device and not for those ongoing annual fees. But again, that's really going to be specific just to that DPH connection only. So here we'll get into the participant types and review the participation agreement. So the MeHI participant types are as diverse as the healthcare community is really. So there are several different participant agreements in work, but for now we're going to focus just on the general agreement, which is for the basic and complex entities, other HIEs, and provider organizations. So here's the whole package. It includes documents that need to be reviewed and signed and understood by the authorized signatory. So an authorized signatory is like a CIO, CFO, president, business owner, anybody that can legally bind the organization. You've got policies and procedures, which outlines the terms and conditions, a BAA, the participation agreement that outlines the roles and responsibilities of each party, and a service addendum. Now, the service addendum, that explains the specific services and any of the applicable terms of use or requirements for those services. So now we have a service addendum for direct messaging that folks will need to sign as they come on board. And once we roll out Query and Retrieve, there'll be another service addendum. So as new services become available, you may need to sign additional addenda as we go through. Documents 5 and 7 I'll get into on the next slide, and we do need a W-9 just to identify the organization, and it's used for invoicing. So I pulled these out specifically because it's a common misunderstanding as to how these documents need to get filled out. So MeHI participants need to designate appropriate access administrators to handle setup, which includes user verification and credentialing. They manage user access, which includes termination or suspension. And they're also in charge of training and educating your authorized users of the MeHI. So they basically manage the MeHI account. So these 3 documents are required to designate the access administrators for your organization. The Delegated Administration Agreement details the responsibility of the role to the authorized signatory. That's the person that's going to assign the role. The Access Administrator Designation Form is used by that authorized signatory to assign the access administrators. Now, we require 2 just because it's best to have someone on available if someone's away or someone leaves the organization. Now, access administrators can be either IT, medical record staff, or office managers. It should be a trusted party, and you can nominate really whomever you feel is appropriate for the role. Now, the Access Administrator Agreement outlines the role to the folks that you designate as your access administrators. So that's the form that those folks need to sign. So we'll need 2 of those. Basically, the big questions around the agreement are, about the MeHI altering the documents or signing documents that a participant requests. And the answer to this is just, it's always going to be no. We can't change the agreement or sign another agreement or a BAA. I consider this a good thing on all fronts because I imagine such a negotiation would certainly add a ton of time to the process of getting you connected. You can absolutely review these documents with an attorney, but you don't necessarily have to. I mean, they're written to be accessible to your authorized signatory. I will say it's understandable that it could be a bit nerve-wracking to go into an agreement, but again, the agreement package primarily outlines that the MeHI needs to be used in a safe and ethical manner with the main purpose of protecting the patient and protecting that trust community. It basically says what you in the MeHI will do to help ensure that. It's not written to be a barrier. So here's everything that needs to be reviewed and signed. Again, we need 2 of the Access Administrator Agreement forms. And here's what the signature page looks like, and I include this again because there's just been a little bit of confusion on it. So for the organization name, it's best if it matches your W-9 or Articles of Corporation. Now, understandably, there are some circumstances where that that might not be the case. So just let us know on the agreement, just because it will add time onto the verification process if we're not clear of that up front. And that byline is actually where you sign, and of course we need your period name, title, and the date. So here's everything that you're submitting. It's a total of 7 forms, and on the W-9, this has come up a bit too. Technically, we do need a wet signature in the W-9 mail to us, only if your organization is not already enrolled in the Massachusetts Management, Accounting, and Reporting System. If you are, a PDF scanned copy of your W-9 is totally fine. So next, when we get your completed package, we'll just verify your organization to make sure you are who you are and that you're an appropriate user of the MeHI. And that usually takes about 2 weeks or so. And then your service manager will get in touch with you for onboarding. So in this section, we'll give you a preview of the onboarding process, which outlines the steps to get connected. When your account is verified, your service manager is going to contact you within 2 weeks after we have that fully executed agreement. So the technical assessment is going to confirm the best connection method for your site, and that's going to depend on your vendor, your use case, your organization type, and all of the other factors that your service manager is going to go into with you. So once that's confirmed, you'll get a participation packet that's going to include some other information that you'll need to fill out, and it'll give you what you need to know about that particular connection type. And it's going to include that provider directory spreadsheet. You'll need to complete that documentation to move forward. We do have some educational resources that we're developing around the provider directory, because there's, this is basically how you're going to be seen in the outside world. This is the HIway phone book, right? So understandably, there's some things that you want to consider, but at that point, you can receive those resources to help you fill that out properly. So after those documents are received, you're going to get your domain confirmed, and your certificates will be issued, and that's going to move your organization into testing. So depending on your use case, getting connected to the MeHI is going to look a little bit different, but the overview really is generally the same. So we first need to confirm your connectivity in a test environment. And once that's completed, we move that connection into production, or like go live with your connection. So, and really once that's confirmed, you're ready to implement your use case and start integrating the HIway into practice. So I will say that it is important, as hard as it can be, it's important to have a dedicated resource or project manager to lead the MeHI onboarding, connection, and integration efforts at your end. It's just to minimize the time and maximize the benefits. The timeline for this setup and test and moving into production will really depend on the availability at your end, and absolutely positively, as well as ours as well. And on that note, I'm really excited to announce that we have a couple of new service team managers that are starting within the next few weeks, so we can better serve our growing network. Oh, so I think it's time. Should we do the last poll? We have one more poll.
We heard that it actually interrupts the screen, so what we'll do is we'll do it during the question.
Okay, so we're not going to do the poll because it interrupts the screen, and we'll do it later. We're actually we're good on time, so we'll have a lot of good time for some Q&A. So final thoughts and key takeaways. And again, I know this is a lot of information on a lot of different topics, but you want to review the participation agreement now. This review can take time, whether or not you're reviewing it with an attorney. Definitely want to talk with your vendor and find out what the status is of their connection to the HIway, your HIway, and see if your regional HIE network is looking to get enrolled with us. And like to what Sean was saying before, you certainly want to engage more than just your IT staff. You want to speak with clinicians, your administrators, definitely your front-end staff and your registration staff to just discuss the value of the MeHI, and really to figure out what the best initial use case will be for your organization. That can help best scope the efforts and can allow you to take a strategic approach to the MeHI integration. again, try to dedicate a resource to the project at your organization to help ensure a smooth, quick process. And the big one, which we haven't gone into in this presentation at all, is you have to start thinking about consent early. It is outlined in the agreement and the policies and procedures. We recently have done great work with the community to develop resources for all to use to start to address this. We're actually aiming within the next couple of months to have a similar educational session like this that is around consent specifically. So again, it's going to be hard. Like your EHR implementation, you should probably expect that there will be a dip in productivity, a big initial time and financial investment before your organization gets used to the tool and starts seeing some benefits. But I think all of the things in life that are hard are worth it, and you can ask my mom. Hopefully she'll agree. It's a hard time to be a clinician or a healthcare administrator, certainly. We're amidst some major but transformational changes, so it's also an exciting time. I will say, honestly, you're each a pioneer in this effort, and the generations after you, both patients like myself and providers, thank you for your ongoing dedication to this effort of changing the healthcare system. So, yeah, contact information. So here is, again, our website and our general email address, and that is my email and my phone as well. Please contact me anytime with specific questions, and there will probably be many that I won't be able to answer off the top of my head, but I will serve you guys as being your connection to the HIway to get those questions answered. And we have MeHI's contact details as well here. There's a lot of great resources on their website. And we certainly at the HIway thank them for their continued effort, and I'm super thankful to have them on board to help me put these educational sessions on for you guys. And we look forward to doing that more in the future.
Great. Well, thank you very much, Amy. That was really a wonderful presentation, and I think clarified a number of things for folks out there. We do have a number of questions, so we'll go ahead and start taking some of the questions now. We'll launch the poll in about a minute, so that if you want to capture any information on the screen, we'll then launch the poll as we go through some of these questions. So let me just start at the top here. And again, if you have any questions, please post them in the questions area. And I'll also look to see if we have any hands raised that people would like to verbally ask a question. I'll just do a quick scan here. Okay, so most questions are written in. So again, the slides will be sent out after this presentation. Is the HIway replacing Virtual Gateway?
I think so. From what I understand, the HL7 clinical connection is where the HIway is going to come in. Now, I will be completely frank that right now I'm still learning really how this virtual gateway works and what is included. So this is from Jack. Jack, if you could shoot me an email and I will make sure to get the specifics, but definitely for those measures that we had discussed, so that's your immunizations, that's going to definitely be going over the HIway, and that was on that HL7 gateway. And if it applies to you, the syndromic and those registries are going to be going over the Mass HIway. So over time, those connections, yes, will go over the HIway.
Great. Next question from Paul. We're about to get an EMR. Should we wait until we are using the EMR to join?
I don't think so. I mean, again, webmail, I think webmail is a good interim solution just to start getting used to moving from the fax machine into electronic messaging. So I think that's certainly something that you can prepare for now, and you can sort of implement at the same time that you're implementing your EMR.
Let's see. We are looking at EMR systems. How do we know which ones will work with the Mass HIway? Let me see if I can take a stab at this one. So one of the grants that we have in MeHI is we call it a vendor interface grants, where we awarded 13 vendors funding to get connected to the HIway. Outside of those grants, there's also a number of other vendor organizations working to connect to the highway, and I think there's probably close to 25, 30 vendors that are working to build a connection to the highway, and some in a HISP fashion, as Amy had talked about. Some are connecting directly, not as a HISP. We don't have a comprehensive list of those vendors yet because most of them are actually mid-cycle getting connected.
They're pretty much, so that's how it's working with these guys. We're working across the board, and you know, we did an analysis, I want to say last year maybe, on who the top EHR vendors were in the state. So of course we started negotiations with those key vendors first, and so they're developing the solution, and when there is one potentially, it goes to a certain very select few sites for testing. So for the most part, that's where we're at, because obviously, I mean, before we roll out any kind of direct solution by vendor to clients, you know, we need to make sure that it's working, and you know, we won't end up getting into a lot of production issues. So that's something that's certainly been on my radar to actually sort of put that information together in a format that, you know, the providers can sort of digest, because it's certainly hard for me to, but so much of it is in testing now. But you can certainly check with your vendor representative and see what their status is with working with us as well.
Let's see, next question is, which EHRs can do the direct connection? And we can fill this one. So in this one, the thing, I think one of the key things to look for in your EHR vendor is, are they certified? So if they're a certified EHR technology, that cert technology, they're listed on the chapel, which is the ONC certified product list, then they're certified. And if they're certified as a complete EHR under the 2014 certification criteria, then they also must be able to do a direct transaction. I'll tell you what I've seen in the field versus on the chapel is that vendor requirement is to actually do a direct transaction, but there is no requirement to actually establish the workflows within the application. So you'll see that there may be a little bit of a lag with your vendors actually having this messaging capability in their products now. Again, they may have the direct capability built in, and they may or may not have some of the workflows that would support that built in. If they're not certified, it's certainly something you directly want to ask. And I think anyway, you would just ask them, are you direct enabled? And ask them also, are you a certified technology? And that will at least give you an indication as to whether or not they are or not. And as always, you could call Highway Operations, and they can answer some of these questions for you. Next question, is a direct connection to you the same as having a direct email address? This is kind of a loaded question. So, Amy articulated a number of ways that you can get connected to the highway. Presumably, if you have a connection to the highway, you have at least one address, one direct address also on the highway. So if you have a webmail account, you're going to have at least one account uploaded into the participant directory, the highway directory, and that would mean you're going to have a corresponding direct address. It would be something like, Sean.Kennedy@direct. yourhospital.masshighway.net. That would be essentially the format of that address. However, you could also have, if you have a landbox or a direct connection, you could have multiple email addresses or multiple direct addresses that correspond to that one connection. So I guess I hope that answers your question. If it doesn't, please either raise your hand or ask that again. But I believe by having a direct connection, it means you are connected to the highway through one of the three options. Separately, you are going to have a direct address, but you could have multiple direct addresses for any one connection. So is that as clear as mud?
Clear as mud. Clear as mud.
Let's see. Is the land an additional cost?
each of the connections, there's that one-time setup fee, and the cost for the land is included in that one-time setup fee, and then there's the annual fees that are after that. So yes, it's in there.
Let's see. Okay. Why would you need a W-9? You're not paying us. So why do you need a W-9?
It's mainly to verify that the organization is what it is, and it's used for future invoicing. Just again, it's the paper trail that we need, especially given the funding stream.
And another comment on W-9, the preferred submission of the W-9 is by mail, correct? Not email, actual mailing it or faxing it, correct?
Well, I mean, it really depends. I see there's another question here on the emailing not being secure. So, I mean, you can absolutely email it to us. We were asking for the W-9s to be mailed if you weren't in the MMARS, I believe, reporting system for the state already. But if you feel more comfortable, would rather send it in the mail, you have the address, you can absolutely send it that way.
Okay, next question. I'm an independent physician, not affiliated with a particular hospital. Can I apply and access the HIway via webmail? Do you still require a W-9, and can I be billed as an individual?
I want to see more independent physicians on the HIway, that's for sure. So absolutely, yes, you can access the HIway via webmail. And yes, we would still require that W-9 because you would come on as an individual user. So I imagine you would fall under a small practice that would probably be Tier 5, depending on how many providers you have with you. And all of that information is on the rate card. So I absolutely encourage you to join. We need more independent physicians for sure.
And just to be clear on that, though, organizations join the HIway, and then individuals, part of those organizations, are then the participants listed in the directory, right?
Yes, sorry. So yes, so the contracting is on an organizational level, and then just because of the way that the HIway works, then the folks that are individual providers that are under that organization, may or may not get access to the HIway, but it's not at a provider by provider level.
What is the relationship between the Mass HIway and local HIEs like Pioneer Valley HIE that I am being asked to join? So PVIX, Pioneer Valley Information Exchange, is a regional health information exchange out in the western Massachusetts. There are other regional exchanges. There's one up in Newburyport. So the relationship between the two is that the HIway is the public HIE. It is intended to be, lack of a better term, the public utility to exchange information in a secure manner. The regional exchanges are actually intended to provide additional value to that particular community. So the big distinction between specifically PVIX and the HIway is PVIX is a data repository. So it's going to afford you more of a longitudinal view of your patient, whereas the HIway is not a clinical repository. It is intended to facilitate the transmission of information, not to store that information. So I hope that clarifies that. These regional exchanges, though, they offer varying services, but presumably all complementary with the HIway. To Nora, the answer to your question is 10, 15, 22, 8, and 3. What's the timeline to get connected?
Yeah, again, it's a tricky one because it certainly will depend on it'll depend on the connection type that you're moving towards. It will depend on the organizational readiness at your end and certainly at our end as well. So it really does vary. It can take, it can take a couple of weeks to a few months, but a big piece of it is making sure that you guys are ready for it.
Okay. And our webinar goes till 1. It's about 3 minutes away. I don't think it's going to end automatically. If it somehow does, well, we'll send you the slides after this. But let me keep cruising through these. You did not mention that costing of land and its implementation. So the cost of the land device and its implementation. So the rate card will indicate the cost of the land device. And there's a connection fee. The implementation would imply getting your EHR connected to the land device, which would be a cost outside of that.
Right. That is important to note that any of the integration efforts that need to happen within your EHR, that's certainly not covered here in the rate card. This rate card, it covers the cost of the land device and our annual services fee. It doesn't include any of the modifications that need to happen in your system with your vendor.
What's the upgrade path if we use webmail and later on decide to move to direct?
Good question. I think that's really going to depend certainly on your vendor, but that's something that your service manager would work through with you.
But your direct address wouldn't necessarily change.
No.
Unless your vendor was potentially a HIS vendor and they maybe issued their own direct addresses, would be the one potential.
Right. So many caveats to all of this, that's certainly.
Yeah, there certainly are. Let's see. Can you please clarify how your secure email differs with services offered by commercial vendors like Citrix file shares? Let me just offer, so this a real brief one on this is generally a lot of these other secure email solutions aren't what we call direct compliant. They may be secure SMTP, but they may not have all the other items as listed in there's kind of this guiding document called the applicability statement for secure direct transport under the directproject.org website. So the direct protocol is very specific. There's a lot of pieces to it, and the HIway provides that. Some of these other secure mail providers may or may not provide that. I understand this is a mandate. What happens if I don't sign up by the deadline? What are the penalties?
So to be honest, the regulations are currently in draft that need to get into all of those specifics. I certainly understand there's still a lot of outstanding questions on that. So I don't have a timeline as to when those will be out for public comment, but it is top of our priority to get that out to you folks.
You mentioned 90% CMS funding for HIway. When will this funding end, and how will that monetarily affect connected providers when it does end?
I mean, I think we should say funding-wise, we're really secure for a long ways out, and I mean that's where the costs here are rate card with the tiered by the organizations. That's where all of that was calculated based on us maintaining the HIE for a certain period. So it's way down the road.
And to be clear, the 90% funding, a lot of that was geared toward the development costs. The ongoing maintenance of the HIway is much less.
Much less.
Let's see. From EMR network assessment to connection, what is the estimated time frame to connect?
Yeah, it's still such a, I wish I could I'd like to get a workflow document down that starts to put that together, but it's dependent on so many factors that it's really difficult to say. But that's why, I mean, it's great if you can dedicate a resource to working on it. That certainly helps.
My EMR vendor is setting up my direct email for me, so why would I need to join the HIway at all?
Again, I think one of the biggest values of what one of our goals is to connect networks and networks and networks across the state, right? So, if you see patients that are, in one network and or in one area and they go elsewhere, then that regional network is not quite as valuable as it is anymore. So that's where the HIway can come in, because we can help make sure that that data can be exchanged across the state.
Can you think of any reason to have more than one connection type? Webmail, land, direct?
I think maybe for a larger organization, say a hospital system that has certain sites that are outside of the hospital, they may have a land for the hospital site and then want to have some of the, the smaller sites that are under them get set up on webmail accounts, something like that. So mainly for the larger institutions is the first one that I can really think of.
Some of the other scenarios we ran into is that you may have a number of different vendors within your organization. As an example, you could have a particular EHR vendor that is a HISP type vendor, and they may get you connected to the HIway in a direct manner. But maybe you're going to have an ambulatory system that provides that doesn't have a great direct interface. You're going to want a land box for them. So you could imagine scenarios where you may actually have different ones like that, much like Amy mentioned. A couple more questions. What does the HIway? How does the HIway relate to drives? So drives, I forget what the acronym means, but it's the Mass League of Community Health Center system that I understand to be an aggregator system for public health reporting for enrolled community health centers. So the idea would be you're a community health center, you're part of the Mass League, you have agreed to send them your public health reporting data or your quality data. That goes into drives, and then the Mass League would join the HIway and submit on your behalf. So how does it relate? I would say it's complementary. Drives for the Mass League may be a node on the HIway, and then you're going to send your information as you would normally do it to drives, and then drives would in turn send it to the respective directory or registry. When webmail is used, what is the maximum file size of the file attachments that can be sent, especially images?
Oh, that's total storage.
10 meg is my understanding is the max file size, because it's not really intended and ramped up to support images yet. Image notifications, yes, but not images yet. If I'm not on the HIway and I'm just using my own direct email, do I have to meet the state's strict permission requirement? So let's go back to the PBICS example, and let's say that an organization has enrolled with the HIway and is using the HIway for secure transport. And let's say another provider has joined PBICS, a privately funded HIE, and they are not using the HIway. Does the permission consent requirement of opt-in apply?
We're both looking at each other smiling. It's a really good question. I'm going to take this back to the team, and this is something that has been coming up, I'll be honest, so I certainly don't have an answer now, but I will say that the discussion is ongoing.
Okay. All right, great. Well, those are the questions that we have. Let me just do a quick look at our attendees. I don't see any hands up. So with that, I'm going to go ahead and go to our last slide. We do have this is a monthly series that we're doing on HIEs. So our webinar next month is going to be on HIE perspectives and understanding national, state, and local initiatives. So please join us. You can register on this link here. And you're going to receive an email from us here directly after this, this webinar. We'd encourage you to please click the survey link. Just complete the survey now to get that done. That'll give us some really great feedback to improve as we go forward. And we want to thank you all for your time, and thank you, Amy, for joining us and sharing your expertise with us.
Thank you all, and please feel free to send me any questions at all. It's certainly a lot for me to learn, and I really appreciate the feedback. Thank you.